All right. Hey. Okay. Is it live on your end?
It is.
Perfect. All right, guys. Hi. How is everybody? I'm super excited to chat with Nina Lane today. I've actually been super pumped all week. Looking forward to this, and so thank you, Nina, for being here.
Oh, it's a pleasure.
Some of you may know Nina. For those of you that have gone through my restart program, I've had her on several times as a guest speaker, whether it's about fatty acids or blood sugar regulation, just all the good stuff. And tonight we're going to be talking about women's health in general and also hormones, right? Hormone balance, imbalance. And we're also going to, or she is also going to touch on autoimmune conditions, which I know a lot of you have been asking about. And I'm sure, Nina, you can relate, or I know you can, that I've been having more and more clients, particularly women, mid 30s, late 30s, into their 40s, who have been diagnosed with an autoimmune condition. So it's no surprise to me that people have been asking about that. So I wanted to share a little bit about how Nina and I met. 3 years ago, we went through the Nutritional Therapy Association, the Nutritional Therapy Practitioner program there. And we had a weekend away in, I keep saying Portland, but it was actually Vancouver, Washington. We had a workshop, 3-day workshop. I'd never met her, heard of her before, and we just happened to sit next to each other at one of the conference tables that first day, and we just hit it off. We started talking, and we partnered up for a couple of activities, and we have since become such great friends. She has been an awesome friend and mentor to me. I have consulted with her on so many things. I learn from her still every time that I talk to her. And I know that you guys will find this, I want to say webinar, but this live super informational and helpful. And yeah, so I'm going to sign it over to you. Oh, real quick. Everything that we share here or that Nina shares here is informational today. We are not physicians. However, and also we don't know what your background is, anything about you, right? So, let's keep the questions to be more general, if you guys don't mind. We're not going to be getting into specifics or deep diving into personal issues. However, if you do want to do that, you can either contact me, contact Nina, set up a consult, and we would be happy to talk to you about taking that deeper dive. So,
Absolutely. Cool.
Okay. Yeah. It's all you.
Thank you, Jamie, for having me, and thank you for that amazing introduction. We are truly blessed to be connected, and I love every time we get a chance to work together. Thank you for inviting me to share with your community. It is definitely a pleasure, and I'm going to share a little bit about, sorry, so I'm trying to share my screen here. You guys can see that. Women's health is a huge passion project of mine, and it's a big component of what I do in my business. And women are a huge part of the clientele that I help. And as Jamie said, like, there are issues that are going on, and more and more, that's who we connect with. So a little bit about me before we get started. Jamie said we did meet as we took our nutritional therapy training. Before that, I was practicing for a few years, and before that, I did my master's in physiology and background in pharmaceutical research and development. Through the years, I've taken lots of different training, and one of the things that has really stuck out with me is actually the autoimmune protocol certified coach, as I work with many people who have complex and often have complex health issues and autoimmune diseases. My mission is really to create a movement of foundational health and wellness. And part of that mission and why I do what I do is my family. I always tell my kids I want to make them faster, stronger, smarter, better than I am. And really to do that, empowering people to take charge of their wellness. so that they can thrive, not just survive. So foundational wellness is really us putting in the consistent work and implementation of health promoting habits. And even when we're looking at women's health, this is such a big component of our women's health and our overall health. And as I said, women are a big part of my practice. 1 in 4 women are dissatisfied with their overall wellness. And I think that comes from many of us being the primary caregiver, or being busy, skewering how we take our role in our society, within our family. And this quote from Michelle Obama really sums it up. We do need to keep an eye on our physical and mental health, because we take care of a lot of other people and a lot of other things between professional and personal life. And we need to keep ourselves on that to-do list. Women-specific health issues come up a lot, like I said, in my practice. From female cancers of breast, ovarian, and cervical cancers, gynecological health. Menstruation is a healthy part of life, but with it can also come some issues. Pregnancy, fertility, even heart disease is a very specific women's health issue, because we present very different than men. Autoimmune diseases. So 70% of autoimmune disease sufferers are women. And I think, the things that make us super women also are some of our weaknesses. Our hormones, our childbirthing can actually put us at a higher risk to develop autoimmune diseases. Along with women's health issues, depression and anxiety is a big one, because it can be linked to our hormonal issues. And what we need to know is that our hormones are the lens through which we view the world. So when they're right, when they're balanced, we're happy, settled. It's like those rose-colored glasses. But when our hormones are unbalanced, they can create a cloud that follows over us, that creates disruption and dysfunction in our life. So it's a very important topic for us to become educated on, as well to address and try to optimize within our own life. So hormones are very complicated. They can be very overwhelming. We can start doing reading and, oh my goodness, are they complicated? They push, they pull, but they can actually come down to some very simple principles. And that's what I want to share with you today. There are many labels that, within the natural health world, within the medical health world, that we have terms that we use, things like adrenal fatigue, sugar crashing, and all of that. But it really comes down to a basic set of our hormones, which involves our HPA axis, our adrenals, pituitary, our sex hormones, as well as our thyroid, and honorable mention for our pancreas. And so when we understand how they work and they connect together in a simple way, we can take power and empower ourselves to try to balance and optimize our hormones. So understanding what's normal with our menstrual cycle for those that are menstruating is very important. We can be experiencing many symptoms that are common, and I'm going to share that slide next, but they might not be normal. But what we need to know is our hormones flex. They go up and down, they ebb and flow, and at certain times of the month, some are high and some are low. So what is a normal cycle? Generally speaking, 26 to 32 days, and that, depending where you look, can shift a little bit. Menstruation, where our flow starts 3 to 7 days. It is normal to be ovulating regularly, and if you're not, you should definitely check with your doctor or check into your hormones and see what is up. Spotting through our menstruation is normal, and even some spotting through the month. Now, we might experience some minimal and moderate cramping along with our menstruation, as well as fluctuations in energy, and that is normal. But what is not normal are this laundry list of symptoms. Being exhausted, having headaches, having severe cramping. Our menstrual cycle should not disrupt our life. And if you're experiencing any cluster of these, that's a sign that your hormones are imbalanced. While they're common, like I said, they're not that normal healthy. And you know, you may speak to a physician or the medical system, and oftentimes the only option is birth control. And that birth control has its place, there's no judgment there, but oftentimes it's used as a band-aid to cover up these symptoms instead of helping them. So over 1 million people worldwide use some form of birth control. And it really does allow us to have control over reproduction. However, while it can help us with our symptoms, it can also be disruptive. It actually depletes the nutrients that our body needs for healthy hormones and fertility health. So we can see this list. They're just your, you can think everyday vitamins and minerals, including antioxidants. But these are very essential for good health in general, as well as good hormone health. So while we are trying to minimize symptoms and disruption to our life, eventually when we decide to come off that birth control, it may actually be more disruptive. Now, on the menopause spectrum, it's a different phase of life. We're not, we might start having irregularities in our menstruation and our cycle. Jamie shared this photo with me. It's hilarious. Menopause, when your wild oats become shredded wheat. And really, there's this full spectrum with menopause, and really that in itself could be a topic. But these are common menopausal symptoms. And, it is normal to experience some symptoms during menopause, depending on your genetic tendency and your health. They can be quite mild and not disruptive at all. But some people have ongoing and very disruptive symptoms that can last for decades. But that's also not normal and can be a sign of underlying imbalances. If you're experiencing any of those, again, it might be time to do some work on your hormones. Now that we're talking about all the things that could go wrong, not to be negative, let's start focusing on the positive. What we need to know is that we have a lot of control over our hormones. We can impact them in a positive way with our choices. And healthy hormones really do start with a healthy foundation, with a good foundation. You can see this hormone pyramid that I have here, really starting with our nutrition and lifestyle. We're going to cover that a little bit more. But you can see that it's really built on the foundation. Then we go through digestion and elimination. Yes, that impacts our hormones, our blood sugar, our adrenal hormones, our thyroid hormones, and our sex hormones. They're all connected. So if we're having issues in one of these areas, we need to dig deeper and look to the foundation. So when we look at factors to consider when we're looking at our hormones, there's a pretty big list, and this might not even be inclusive. So diet is a big one, and we're going to talk a little bit about how diet can impact our hormones. What you do eat and what you don't eat equally can impact our hormones overall. Your stress level, so not just physical stress, but also mental and emotional stress can have impacts on our hormones. They directly impact our adrenal hormones, and that can then cause a cascade impacting our thyroid and metabolism hormones, as well as our menstrual and sex hormones. Now, exercise. We have to find our sweet spot with exercise. Too little can have a negative impact on our hormones, and too much can have a negative impact on our hormones. But just the right amount actually is so beneficial on multiple levels for our health and our hormones. Sleep. Now, we can all be busy. We have high stress, we have deadlines, we have all the responsibilities of life. Sometimes sleep is the thing that gets neglected. And that is not something that we should do. We should focus on getting enough sleep. 6-7 hours is ideal a night. That will actually help to reduce our stress hormones. It can help to elevate certain positive sex hormones, and is important overall. Digestion and elimination. So how are you utilizing the food that you're eating, and how are you removing the waste, including our hormone metabolites? Estrogen is one that actually gets packaged, and we eliminate it with our stool. So how fast or how slow your stool is moving through your body is actually very important. Certain medications can impact our hormones as well. Whether it can impact our blood sugar, our adrenal hormones, and even our blood sugar hormones. Environmental exposure, very similar. So are we getting, things like phytoestrogens or xenoestrogens from our surrounding areas, from paint, that sort of thing? Those can also impact our hormones. And then a factor that we can't control, our age. So yeah, we're not going to spend too much time on that. But if we're young and menstruating, or we started to see some shifts into that menopausal stage. Now, so our diet is a huge component for our hormonal health. We have potential helpers and potential disruptors. And so you can see the list here. Coffee, a small amount tends to be tolerated for most people. It even can have health benefits. When we get into that 3+ cup a day habit, then that can have a detrimental effect for our hormones. Sugar in itself can be disruptive, as well as too many carbohydrates, especially if they're processed or refined. And we're going to talk about blood sugar balance coming up here, but essentially if we're intaking a lot of sugar and carbohydrates, then that can contribute to blood sugar dysregulation, which can impact the rest of our hormones. Alcohol consumption. Unfortunately, even moderate alcohol consumption can have an impact on our hormones. So being aware of that, if we're having issues, we might need to limit, avoid, or take a break for a little bit. As well as soy. Soy is a food that contains plant-based estrogens. And so if we are sensitive to that, that can also cause disruption within our cycle or within our hormones if we are in menopause. Now, when we look at our hormone helpers, a lot of these make up our basic healthy eating. Okay, so healthy fats, we don't want to be eating a low-fat or fat-free diet. If you've been following Jamie, you probably know that. She's amazing for educating on what type of food and healthy types of foods to eat. So we actually want to consume a good amount of healthy fats. They're actually used in the building of our hormones within our body. So we want to consume healthy fats. Quality protein keeps us satisfied. It suppresses our hunger hormones, but it also provides the building blocks for tissue repair and tissue building, as well as amino acids for hormones and neurotransmitters and all the wonderful things. And actually, in my practice, I see women often struggle to get enough quality protein, and that can contribute to some blood sugar issues as well. And then also the other macronutrient, carbohydrates. So contrary to popular belief, carbohydrates are not all bad. In fact, they're quite good for us. And we just want to pick the quality ones. So primarily vegetables, some in-season fruits, and quality whole grains if that's tolerated by you. And what those provide for us are fiber, and fiber helps with that elimination of our hormone metabolites. And also leafy greens provide antioxidants, B vitamins, and even quality minerals that we need. Cruciferous vegetables. Cruciferous vegetables are special because they have plant compounds that actually help us with our estrogen balance. And estrogen is huge for our hormone balance. And so even eating a cup of things like broccoli, cauliflower, Brussels sprouts, kale, and there's more, can be helpful in managing hormone symptoms. Probiotics and fermented foods can also be very helpful. A healthy gut flora is important for almost all aspects of health, including our hormones, and also very much involved with that proper elimination, which helps to balance our hormones. So when we get down to it, one of the key principles I'd like you to take away today is that balancing your blood sugar is essential to optimizing your hormones. If you focus on those hormone helper foods, you'll do a good job of balancing your blood sugar. And we can start, we can get distracted by things like PMS or cramps. Maybe our metabolism isn't doing what we want it to do. And even into menopause, maybe we're having hot flashes or, memory loss or fatigue. We can start doing things that chase those symptoms. But when it comes down to it, we really need to focus on our nutrition and lifestyle, which then will work towards balancing our blood sugar and optimizing our hormones and our overall health. So I wanted to ask you, and we can talk about this, we're almost at the end of the presentation, but I want you to think about it. Are you riding the sugar roller coaster? And these are some symptoms of, blood sugar imbalances. It's not all about high blood sugar. When we think about blood sugar issues, we think about diabetes, but it actually can be a lot to do with hypoglycemia or, when we're jumping up and down in our blood sugar. And we can really sum up how to balance our hormones in 4 simple steps. And this is very simplified. But 1, manage our stress. So mental, physical, emotional stress has an impact on our body. It elevates our cortisol, which can disrupt our thyroid and sex hormones, as well as our blood sugar. So how we perceive stress, how we set boundaries, that is all important to balancing our hormones. Eating well, and we've discussed a little bit about how eating well helps your hormones, whether it's from blood sugar or providing the nutrients that your body needs. Exercise, so moderate exercise, even just like walking, yoga, 30 minutes a day or most days of the week can be very helpful. And if you're thinking, wow, that's still a lot, start where you can. Exercise is very helpful for reducing stress but also balancing your hormones. And then lastly, get some sleep. As we talked about, sleep is very restorative. It actually helps to lower cortisol and is very restorative for the overall health of the body. All right, so that's it. I'm going to stop sharing now, but I want to thank you for listening, and I look forward to your questions coming up soon. If you want to get in touch with me or have questions about your hormones in specific, feel free to message me on Facebook or get a hold of me at the email there.
That was excellent. And it was a crash course, right?
It totally was. It totally was.
Like you said, it's just such a complex topic and it's so bio-individual. Like even the questions that we're about to go through, it just depends. They depend on so many things, right? And, people have different tolerance levels for, when we're talking about diet, they're impacted by different foods than maybe the next person. And then stress levels. I mean, there's just so many things to look at, and, inflammation in the body, right? Like there's just so many different things like that. It's cool. It's like everything's connected.
That was like a 1,000-foot view. It for sure was. But what we have to understand is we don't want to get taken away too far into the details, because when we focus on the foundation, we can be a lot more effective than dealing with individual symptoms alone. Absolutely.
And I've shared this with you before, but I want to share it here. I've had more than a handful of participants going through the restart program. One of them in particular, she came in with symptoms that were related to digestion, and that was what brought her to the program. And her digestion, her symptoms improved greatly. But one of the biggest surprises for her was that she normally for years would have crazy, terrible PMS symptoms like bloating, pain, headaches. Her skin would break out every month. And like you mentioned, the whole common versus normal, right? So she just kind of, it was just the thing that she experienced every month.
Yeah.
And 3 weeks into the program, she did not have those symptoms. And she was just like mind blown that and all we really focus on in Restart. I mean, we talk about mindset and we talk about stress a little bit, but we really focus on the nutrition and the foundations of getting in those fats, right? And getting in, optimizing digestion, and blood sugar is key.
Yeah, for
sure. And she was just like, oh my gosh, I cannot believe that just from changing my diet and avoiding all of the refined sugars and getting in those fats and all the things that we do, right? Everything you just mentioned. that she
Mhm.
just found such relief. Like,
It is really important to know the power of that nutrition and lifestyle. Uh, very much like you, I see clients with a variety of symptoms that they've had for years. Many of
mhm,
them, it's like, this is just life. I get a headache 2 days before my cycle,
mhm,
and then I can't go anywhere for the first day of my cycle, and it's very disruptive. Or, I had a client that just with COVID, I feel like the stress of COVID really increased her symptoms, but she ended
mhm.
up on birth control, and then she ended up on anxiety medication, and then she was like, I just feel like this is not normal. And through this very like you, targeted nutrition and focusing on the foundations, she was able with her doctor's approval and on her own time to stop those medications. She's no longer anemic, and it is possible to uh, improve your hormones when you get the right information and target them.
Right. Yeah. The other thing that I was thinking of when you were talking about what's normal and common and the difference is, I know for myself growing up and many others, because I've talked with them about this, you're just taught that menopause is this terrible experience and,
Yeah.
it's dreaded, right? I mean, you just hear of all the negative symptoms that women have, the hot
Mm-hmm.
flashes, the trouble sleeping, just a myriad of things. And, once I kind of came into this wellness space and started learning about all of this stuff, it's like, oh, you mean it doesn't have to be that way? Like you can,
Mm-hmm.
support your body through that phase of life and in general, through all phases of life. And you
It can
will,
be a graceful transition.
yeah, yeah. Not everybody experiences those things. And it's like,
Mm-hmm.
oh, well, that's pretty cool. I do have more control over it, like you said, than what we sometimes are led to believe, right?
Mm-hmm. Absolutely.
Yeah. Cool. Well, do you want to start tackling some of these questions that people
Yeah.
shared, or is there anything else that you wanted to? I
No,
don't know.
let's get into questions. Are there
Okay.
any comments? Questions in the comments?
There are
Anything?
no comments yet. I mean, there's some hi, I made it, yay, excited to be
Yay.
here, which is cool. But while we're on that, if any of you have any questions, about anything that Nina has just said, or moving forward, anything that she shares or that I share,
Mhm.
I can see the comments. So
Yeah.
she can't, but I can definitely say, hey, we have a question, and we can talk about that. So that's the cool thing about being here live, right? Okay. So one of the questions, let's keep it very general first, because some of them are more
Mhm.
specific, but
Okay.
ways to balance hormones or support my body, being that I'm now over 40.
Okay.
This particular person says, she knows it's not a one size fits all thing, but now she's just becoming more mindful. She's aging. She still feels great and she's young, but she wants to
Mhm.
know how to specifically support her body, maybe in a different way now than maybe 15 years ago.
Mhm.
Um, so any advice for
Okay.
that or?
Well, so 40 plus, that's where we could be entering that perimenopausal space. So we're not 20, a spring chicken anymore. I'm currently almost there, not a spring chicken anymore. So I can say that as no, that's just what it is. And so what we want to do is we really want to focus on that blood sugar. So it comes down to blood sugar regulation. So balancing each of our meal spacing could be important, so we want to make sure that we're not, every time we eat, insulin is released, right? And insulin puts us, it impacts our metabolism, it impacts what we do with the energy that we're bringing in. So meal spacing, that 3 to 5 hours when we're looking at our meals, we should be able to be satisfied and energized. So a meal that could do that is something that would have quality, when we talk about healthy fats. Okay, so anything from, omega-3s from fatty fish or walnuts or pasture-raised eggs, or we could do something more like seeds, nuts, even all the way up to saturated fats of,
Mhm.
quality butter, ghee, or coconut oil. So we want to choose, there's a wide variety, and we want to get a wide variety of fats.
Mhm.
Then quality protein, choosing your choice of protein, because like I said, it is a very common thing in practice for women to not even be getting 20% protein in their diet, which is huge. So making sure you're getting your quality protein. and then really focusing on your vegetables. So when it comes to carbohydrates, I think one of the biggest things that we can do for our health is eat a lot of colorful vegetables, particularly maybe trying to focus to get those cruciferous vegetables in. If you have a thyroid condition and you're concerned about eating them raw, make sure you cook them. That can be helpful with that. But just a nice balance of, you know, non-starchy, so things like salad or kale. Give me some examples. Cabbage,
dark leafy
onions,
greens,
dark leafy greens, or starchy carbs like beets and root vegetables and sweet potatoes, squash, those guys. So we kind of want a nice balance there, but you know, it's focusing on the positives, not just what we shouldn't be eating, but you know, working on establishing that routine of healthy, just balanced eating, you know, at least 90% of the time.
Yeah, I agree. And could you speak a little bit to, I know I get questions about when we talk about real whole food carbs, right, versus the refined processed carbs. But let's just look at the whole food carbs here for a second.
Okay.
So some people ask a lot about grains, like whole grains, right? So looking at, you know, oats and rice and quinoa and things like that versus your sweet potatoes and your squash and, you know, those kinds of whole foods, non-grain foods, right?
Okay.
Are there compounds maybe that we should be mindful of in grains? Or
to avoid, or let's just do, can I do like a summary of like where, how to help choose them? I'm like, there's multiple points.
I know. Sorry.
Okay. No, that's okay. That's okay. No, this is good. It's just like how specific. When we're looking at choosing grains versus vegetable-based carbohydrate, there's a couple of things to consider. Now, in our food guides, we're told we need grains for the fiber primarily, but also for some nutrients. Now, when you compare vegetable-based carbohydrates to grain-based carbohydrates, actually, they're very comparative in their fiber content, okay? However, on almost every nutrient, vitamins, minerals, our vegetables will outperform grains all the time. Now, we also have, you know, starchy carbs versus non-starchy carbs. So a grain, a whole grain, say hopefully we're eating whole grains, they're not necessarily unhealthy. And they do have some fiber, which slows down the blood sugar. So when they contain starch, which is transformed into sugar quite readily, okay? And so the sugar is going to go up and it's going to come down. And when we look at some vegetables that are starchy, like our root vegetables, beets, squash, those types of things, they also have fiber. So it's going to kind of have a very similar blood sugar profile. Okay, so those guys would be comparative. So grains to starchy carb comparative. When we look at non-starchy carbs, like our leafy greens, our salads, kale, cabbage, so many, those guys are not going to give sugar readily when they're broken down. Okay, so they're non-starchy. It takes quite a bit. So it's going to have a very slow impact on your blood sugar as well. So depending how your blood sugar is, your health, your balance, you know, you might want to shift how you're choosing your vegetables.
Okay, that's awesome.
Did I answer your question?
Yeah.
Okay.
And I mean, would you agree that a lot of grains are a bit harder to digest than you know, your non-starchy carbs like squash or sweet potatoes? Or I get questions like this all the time.
Okay, that one depends. Okay, so it depends. So when we look at things like roughage in our diet, even vegetables, they have what's called they have FODMAPs, which are harder to digest carbohydrates. So some people might find that certain vegetables make them bloated, and that might mean that they need some digestive support. Now, grains, whole grains also have some of those fibers that are hard to digest, so they also have FODMAPs, but they actually also have plant-based proteins. Like you might be familiar with gluten. That's a plant-based protein that's hard to digest. But there's also saponins and lots of different phytates would be another one. And there's some that are in legumes as well. that are hard to digest and actually do have the potential to disrupt our digestion, as well as bind to minerals and nutrients. So they are a little bit harder to digest. Soaking and sprouting them can make them more tolerable, more digestible, but there is still some of those proteins there.
Okay, great. And, you know, it's always good. I always tell clients and restart participants to make sure to add some good fats in with those carbohydrates, because that also helps with the blood sugar not spiking up too high, right?
Absolutely.
Like, definitely helps it out, or helps you out.
For sure.
Okay, cool. How can we support our bodies if we have really bad PMS symptoms? So we did talk a little bit about this, or I brought up the example.
So if we're in the moment, like acute PMS symptoms, this sounds probably really just rudimentary. Rest is important, okay, if you need to rest. Hydration. So hydration is a really big part of our health that often gets overlooked. So making sure you have proper hydration with even some electrolytes, that would be helpful. That can help to relax muscles, even in the uterus. You know, there are some natural remedies that I like to use. No sales pitch here, but they're actually a combination of essential oils that you can apply directly if you're having some cramping. When we're looking at PMS symptoms beyond just like in the moment, say like cramping or fatigue or headaches, you know, there's a whole laundry list we could look at. It's really about setting yourself up for success. How you're feeling today is the byproduct of the things that you've done. Not, you know, energy wise, it could be the past 3 days, but you're really the sum of like what you've even done over the last month. So if your cycle is particularly bad, maybe look at what you did. Or if you like know that you're struggling with PMS regularly, maybe make some shifts. So things that we could do throughout the month, that mild to moderate exercise. Like, it doesn't have to be intense. Any exercise is good and can help balance our hormones. Particular nutrients that we may want to focus on are things like omega-3 fatty acids. So whether it's a supplement or fatty fish, flax seeds, chia seeds, sardines, walnuts, like just for ideas for yourself. As well as leafy greens, and so those are great source of magnesium that can help. Magnesium is amazing for helping to promote healthy hormone balance, especially progesterone. And then also leafy greens are rich in B6. Okay, so eating quality foods is really a big part of it. So looking for sources of B6 and magnesium and omega-3s, those can be huge for helping to reduce PMS, even in as little as 1 month. So those are some helpful tips to get started, as well as focusing on hydration. For like if we're looking at perimenopausal symptoms, we have to look into which ones we're doing. I feel like that needs a little bit more digging in. Are we having, like, how's our flow, the length of our cycle? It depends.
Okay. Yeah. And you probably answered, this next question just came in on the chat. And from what you just shared, she may have had some answers to this. She says, I've tried everything I can do to curb hot flashes, but nothing has worked. I'm 56 and I've had hot flashes for 5 years now. I stay on a good diet, drink bone broth, meditate, limit caffeine, and I've used clary sage, etc., but nothing has helped. I have the majority of the stated menopause symptoms that you stated.
Okay. So menopause is a different beast from PMS for sure. So you're already doing some good things. Making sure you control that blood sugar. You know, if you're been in Restart with Jamie, that's a great start. There is studies showing adding a cup of cruciferous vegetables daily can reduce menopausal symptoms as well. Okay, and so balancing blood sugar, getting the right healthy fats, increasing that cruciferous vegetables, and you know, you might want to look into your elimination. So not just if you're having a bowel movement every day, it can go a little deeper than that, but even like maybe you need to support the liver with some nutrients, because the liver, so we're not detoxing, okay? Not, don't worry about that, but we can support the liver to do its job, because that is where our hormones kind of get, it kind of like, hey, how much estrogen do we have? And let's take this estrogen and take it out so we stay balanced. And then that packaged hormone goes into our bile, which then goes into our food matter, which then turns into our stool and is eliminated. So we're looking at our hormones, it has to go all the way back up, and we have to see what's going on there. Another aspect of menopause is actually adrenal health. So your stress balance, and we were in part of our training when we did our nutritional therapy, they said our hormones is kind of like running a relay race. So pre-puberty, our adrenal glands are actually responsible for producing our sex hormones. And then when we go into puberty, the baton is passed to our ovaries. And so they take over the primary job of making our sex hormones. Now, when we enter menopause, they can then hand that baton back to the adrenal glands. Now, if we have healthy adrenals, that's generally pretty smooth. However, if we have had high stress, depending on life, our adrenals are always up and down, and maybe they're, entering into that very vague space of adrenal fatigue, then that can contribute and exacerbate our menopausal symptoms.
Yeah, I love that analogy. I remember hearing that story. Like, oh yeah, that makes sense.
Totally does.
And the other thing I wanted to say too is I find, and I was there as well, right? When you transition away from eating the standard American diet, and by that I mean, lots of processed foods, you're not really paying attention to what's in those foods, and then you transition from there to eating all or mostly whole foods. That's great. The next step that you want to look at is those macros, right? Like, so you may be eating super clean and, all real whole nutrient dense foods, but if you're eating lots of potatoes and grains and not as much of like the non-starchy veggies or not enough protein, that's still going to cause you issues, right?
Yeah, for sure.
So it's just something to kind of think about. And sometimes we just have to be our own. There's a lot of experimenting and tweaking and figuring things out. So we need to have patience and give ourselves some space and grace, right?
Absolutely.
Okay, so another participant or viewer asked what kind of vegetables I think she was referring to cruciferous. So that would be, it's a class of veggies. So like your Brussels sprouts, broccoli, I think is
cauliflower, kale, actually, collard greens. Those guys are all cruciferous vegetables.
Okay, cool. Yeah. Let's see. What are some common misses, those are in quotes, that you find with women who are struggling with hormone imbalance? So I think they go ahead.
I totally get it.
Oh, okay. Go ahead.
Okay. I would say, so my clients that are coming to me that aren't already off the standard American diet or Western diet, is actually a lot of people are dealing with hypoglycemia. They're maybe not getting enough nutrients as well, but one of the biggest things that women come into me with is hypoglycemia. Either they're not eating sorry.
That's okay.
Low blood sugar. Sorry. Okay. Yeah, let's keep it simple. So hypoglycemia or rebound hypoglycemia, which is, low blood sugar is when your blood sugar drops below the normal range, and your body has to compensate for that. And it's actually a type of stress. Your body actually uses stress hormones, particularly cortisol, to help balance that out. And rebound hypoglycemia can actually come when we say we have a quick fix or, refined carbohydrates, even things like fruit, honestly. So this is a misconception for people. Fruit is healthy. Let's just put that out there. It's healthy. But so we're hungry and we grab our banana and we, but then all it does is it's very digestible. It's actually could be quite a quick source of sugar. And so it's going to go up and it's going to go down, and it might last you an hour. Okay. And what can happen is our blood sugar can actually dip, or say we treat ourselves to something, use your imagination.
Yep.
We eat a lot of carbs, a lot of calories, and our blood sugar just goes skyrockets high. Our body has to overproduce insulin, and the insulin is like, hey, get it out of there. And then you come crashing down. If you've ever felt fatigue after eating, like 20 minutes after eating cake or treats, or you just all of a sudden you don't feel well, that can be called, yeah, rebound hypoglycemia, right? Yeah. The other thing is that I know as a mom, as a woman, you can get busy, right? And so what you might not mean to, but all of a sudden you're like, it's been 6 hours and I haven't eaten anything. You might start feeling fatigued, headachy, jittery. And that's your body like, getting low on the blood sugar. So hypoglycemia and then its impact on cortisol can actually really start that domino effect of hormone imbalance. It can start impacting your thyroid, it can impact your sex hormones. And that really it's a very common imbalance that I find with my clients. And it's pretty easy to fix.
Yeah, thank you for that. And the other thing that I was going to ask you, actually, you mentioned a little bit ago, was in reference to meal spacing. I get quite a few people that come in and they're like, gosh, I was in this other program and they want you to eat every 2 hours, or, I just grew up thinking that it was better to eat that speeds up my metabolism when you eat only, and when you don't, go 4 or 5 hours, you kind of are constantly snacking. So what are your thoughts on that?
On the grazing?
Yeah.
So what we have to know is every time we eat, so I'm not going to label anything good or bad. We're going to just kind of look at optimizing things. Every time we eat anything that's going to elevate our blood sugar, our body releases insulin. And insulin is a hormone that tells our cells to take the blood sugar out of the blood and take it in for energy. Okay. Now, what happens when we're eating every 2 hours, even if we're eating small meals and we're not going into high blood sugar, so let's just say we're just not going into high blood sugar, the meals are healthy, but we're eating every 2 hours. Eventually, your body gets resistant or desensitized to that insulin response, which can then put us at risk for more weight gain. Okay, higher blood sugar, then we're going to be accumulating triglycerides. And there is some evidence, that insulin, once it's released, we're in that energy storage mode. So then when we eat again, we take that energy and we could be storing it at a greater rate because of that insulin being there. So my recommendation, just generally speaking, especially for people who are currently more of those grazers or hypoglycemics, they're like, I have to eat every 2 hours. Once you start eating with some recommendations, generally that's not the case. But when you're starting out, I recommend a 3 hour minimum window, but 4 to 5 is something that if you're eating a good meal, that you can feel energized and great. And that's really good for your hormones. The other thing with eating windows is, we can talk about intermittent fasting just briefly. That's a rabbit hole in its own.
Yeah.
Not everybody is a great fit for intermittent fasting, especially if you're dealing with hypoglycemia or already have high stress. But one of the things, if we're going to be doing a short window of eating, that can be increasing our cortisol through the day. Let's say we're not intermittent fasting, but still embracing kind of a period of eating and a period of fasting. So I always recommend my clients to optimize blood sugar and hormones. Kind of 12 and 12 is a good place to start, or say 10 eating, 14 fasting. But generally that is it's a good eating window without elevating the cortisol.
Awesome. Thank you. And just a reminder, you guys, some of you just popped in. If you have any questions, we have a little bit more time. I have a few more questions that were sent in to me that I'm going to ask Nina, but pop them into the comments and we can maybe chat about them. I can share
Mhm.
Okay, so let's see what else we have here. I know we had a couple more.
Should we talk about Hashimoto's? Because I
Oh,
don't want to
yes,
miss that
yes,
one for our
absolutely.
people.
No,
I
that's
was like, I know that was
perfect.
asked a couple times, and we touched on autoimmune disease,
Hmm.
and I just briefly glossed over it during that because it's a big and in-depth topic.
No, thank you
But it's
for bringing it up. Yep, go ahead.
okay. I was like, I don't want to miss it because I feel like people might be disappointed.
Yep.
Yeah, so Hashimoto's is an autoimmune disease where the body attacks the thyroid. Now, many people who have hypothyroidism, where their hormones are testing low, may actually have Hashimoto's thyroiditis, um, but are not properly tested.
Hmm.
And our conventional medicine also, they just replace the hormones. So what happens is when we have these antibodies produced against our thyroid, is it actually blocks the receptors. So your brain is releasing thyroid stimulating hormone, a hormone that tells the thyroid produce more hormone.
Hmm.
But then the antibodies are coming in and blocking that hormone from doing its job. And so what happens is the thyroid generally starts to enlarge because that's one way that it produces more hormone, but the damage keeps occurring and your hormones will drop. And when your thyroid hormones really set that metabolic point, how fast or how slow is your body going to go? And so it's a really important part of our health. And so, you might have perfectly normal blood levels, say if you've been diagnosed with Hashimoto's or even hypothyroidism, and the doctor, replaces your hormones. And that's perfectly fine and perfectly normal. Your hormones will come up despite the autoimmune disease, and you should start to feel better. But oftentimes people don't feel better, or they're just not quite right.
Hmm.
Okay. And the doctor just is like, I don't know, unfortunately, and no bad, nothing. It's just, this is a common story I hear. And so sometimes we need to look deeper. We do, if you haven't had your antibodies tested in a while, maybe have your antibodies tested, because that can be a marker of how active your immune system is, or if there's damage still occurring.
Hmm.
And then you might need to consider a therapeutic diet protocol, even just to consider, are there some foods that are causing inflammation or modulating the immune system? Modulating means having an effect, either positive or negative, on the immune system. You might want to be aware of supplements that can stimulate your immune system. Because when you have an autoimmune disease of any kind, so whether it's eczema, psoriasis, inflammatory bowel disease, any of them, okay, there's 140 autoimmune diseases. They all have similar roots in gut health. Okay, so you want to work to support your gut health. And it's the immune system kind of, acting out of balance, where it's gone overactive and it's then starting to act against some of your own tissues. So sometimes it means taking out some foods that can trigger the immune system. It means being aware that certain things that are healthy might not be a good fit for you. So this is really important for optimizing your health, right? Because there's lots of healthy foods that might not be a good choice for you. And so when you have Hashimoto's and you're, on that journey, you want to consider, what are you eating? The blood sugar does play into it, but maybe there are some additional foods that might not be a good fit. And if you're struggling with ongoing fatigue, you want to make sure your doctor's doing the proper testing of not just testing one hormone or even two hormones, but they're getting a full panel. And then they're also looking at that antibody level, because the damage can still be occurring even if your clinical thyroid hormone levels are normal.
So with the testing, because as you mentioned, and I find it as well, I have clients coming in, Hashimoto's is definitely more prevalent, I would say, this year. I've had a number of clients that
Really?
have Hashimoto's, or definitely an autoimmune condition, or they're in the beginning stages of trying to navigate that. Like there's maybe some suspicion there. So when they are going to their doctors and they haven't had a lot of these tests, would you say that just asking for a full panel is enough? Or would you, because I know that we talk a little bit about like free T was it free T3 and T4, that sometimes those are not included in the full panel, right?
Yeah, well, no, I think a full panel would include those.
Those two? Okay.
Those ones. So your doctor might just look at your thyroid stimulating hormone or your TSH, because oftentimes that's like the basic minimum. Oh, if that's normal, then everything else should be normal. But yes, your T4, your T3, your reverse T3, and then you actually have 2 thyroid antibodies that could be produced. Thyroid peroxidase antibody, and that one is the one that is generally elevated in Hashimoto's thyroiditis. And then also thyroglobulin, which is generally elevated within Graves' disease, which is generally hyperthyroidism.
Okay.
Yeah.
Thank you for clarifying. I get that question a lot. Like, I'm going to go to my doctor. What should I specifically ask for? Because part of what I love helping clients with is advocating for themselves. And, you know, as you know, and I'm sure there are people nodding their heads right now listening to this, sometimes, you know, not all, but sometimes physicians, they have their standard way of doing things. And, you know, the tests just don't give us the answers that we want, right? So sometimes it's helpful to know what to ask for and to, you know, advocate for that.
Absolutely. And you know what, generally most physicians work pretty well with you when if you go and ask in, you know, generally a kind way. We're different in Canada here. It's just all part of our healthcare system, so it's a little different. And some doctors are very open and some are not. But if you're looking and you're thinking maybe something's not right and, you know, things are testing, it is important to continue to ask and to advocate for yourself. There are private health tests that you can do. And even if you're thinking, okay, my digestion, my gut, my elimination, there are tests that you can do privately. I offer my clients GI map or another functional stool analysis that helps to know, like, what's going on? Is there dysbiosis? Because we know that our gut health is very important to our overall health in general, right? Our hormones, our brain, our immune system, and all of that. And that can be related with autoimmune disease development as well.
Yes, definitely. Great. Thank you. I just had a question come in on a text, actually. Can a vegetarian or vegan way of eating impact hormones in a negative way or at all?
In a way? Well, let's see. So I'll just come out and say it.
Good.
Both Jamie and I are both like more traditional paleo-ish type eaters. I do eat some grains. I think the biggest thing to remember is to focus on nutrients. And one of the things with eating in a vegetarian, lacto-ovo or pescatarian, you know, those tend to be better. If you're a strict vegetarian, it is more difficult. Plant-based minerals tend to be harder to absorb. Jamie and I had mentioned those proteins that are in the grains. So not only do they inhibit digestion, but they actually make the minerals less absorbable. For example, plant-based iron, so it's called non-heme iron, you might find it in your greens, can be 4 times harder to absorb than an iron that comes from, say, ground beef or liver, something like that. So some plant-based nutrients are harder to absorb. And, you know, our animal proteins tend to be pretty perfectly packaged. When you think about like an egg or even liver, like the cofactors that are in there, the fat-soluble vitamins and the minerals that come with that protein tends to be perfect, or, you know, like we can utilize it. Now you can have hormone balance with a vegetarian diet. You really do have to be very intentional, because when you're looking at plant-based protein, for example, like a bean or a legume, or even quinoa, it's still primarily carbohydrates. So your plant-based protein is still primarily carbohydrates. And so if you can end up with a lot of carbohydrates and not enough protein. And protein quality is important for, overall protein synthesis in your body, tissue repair and maintenance, and getting the balance of amino acids that you need is super crucial. So I guess, yes, a vegetarian diet could impact your hormones, but it is possible to have healthy hormones with a vegetarian diet. Vegan diet, you would definitely need some supplementation to make sure that you're getting all those nutrients.
Yeah. And, I think, and you hit the nail on the head, or one of the points that you made was the blood sugar. Throughout this presentation, right, you're talking about blood sugar regulation, and that's what I find, whether it's people just reaching out to me online or clients that either were vegetarian or vegan in the past, and then, we're running into some health issues and then started to add in back again, right, some animal proteins and things. But their blood sugar, there was just a lot of dysregulation there because they were eating primarily grains and beans and potatoes, and so that's something to keep in mind, like when you're looking at those proteins.
I do think, and I do think when you think about women's health, oftentimes it does, a lot of our health issues relate around hormone balance. Like even if you think of like women-focused cancers or anxiety or heart disease, it really can, boil down to hormones. And when we look at our healthy hormones, looking back to the foundations is important. So, how are you digesting? What are you eating? And when what are you eating, are you keeping your blood sugar balanced, right? So, it can be a very complicated and not straightforward topic. And it really does depend on individual factors. But if we're going to take some takeaways away from here is, focus on that nutrient density, focus on that blood sugar balance. And if you're having some digestive issues, get in touch with Jamie or myself, and we can help you navigate them. If you have more questions, make sure to get in touch. I offer all potential clients a discovery call, especially if you're looking to, talk about hormones or autoimmune disease. Virtual is definitely something we can do, and I'd be more than happy to help.
And I'm telling you guys, I highly recommend Nina. We've had lots of consults where we're just digging into labs. She can read a lab like, she's just great at it. I highly recommend her. So definitely take her up on that consult or discovery call if you are struggling with a lot of these issues, or you're not getting the answers, that you feel that you need related to hormones or any of the topics that we talked about. Definitely reach out. And on that note, I do have a restart class coming up April 11th. I will post about that in the comments as well, just some links, but it's a 5-week group coaching program. We dive into these foundations. Blood sugar regulation gets 1 whole week, fats, digestion. We talk about how to build a plate, looking at those macros, and mindset as well. So let me know if you're interested. And so thank you so much for being here, Nina. And we'd love to have you back sometime. And thank you all for watching. If you missed this and you're just able to watch the playback, you can still maybe post a couple of questions in the comments, and both of us will be tagged, or I can tag Nina. So feel free to do that as well. And I don't know, anything else?
An hour went fast. Oh my goodness.
I know. Yeah. And we could just talk for hours and hours and hours.
We can come back. We'll come back.
Yeah. And if you guys have any other topics that you'd like to learn about or talk about, let me know, because I'm looking forward to, not only can we have Nina back on, but I'd love to have other, people come on and speak to you guys about various topics in the field. So let me know about that. Everybody's saying thank you, and they enjoyed the presentation. And
you're welcome.
So,
thank you, everybody.
Yeah, have a good night, and I will see you soon. Yay, everybody's like, yay. Okay, now I gotta figure out. There we go. All right, bye.